अच्छा जी, आज मेरी नज़र से एक वीडियो गुजरी जो कि यूएस सेनेट की वीडियो थी, जिसमें वो शॉर्टेज ऑफ नर्सेज के बारे में बात कर रहे थे, बर्नआउट के बारे में बात कर रहे थे। ऑब्वियसली शॉर्टेज ऑफ नर्सेज होगी तो बर्नआउट भी होगा। हेल्थ केयर वर्कर्स की शॉर्टेज आजकल जो है वो इंटरनेशनल क्राइसिस का इख्तियार कर गई है। तो अब मैं ये सोच रहा था, मैं उनकी ये वीडियो देख रहा था तो मैंने सोचा कि ये सारे मसले मसाइल तो हमारे हेल्थ केयर सिस्टम में भी मौजूद हैं, लेकिन हमारी असम्बलीज़ में, हमारी सेनेट में इस तरह की कोई बात नहीं होती। खैर, वीडियो देखते हैं, हमें वीडियो आगे फिर बात करते हैं।
And what has impressed me is that nurses have come into my office with tears streaming down their eyes. And you know what they were in the office? So not to say we need more money. Yeah, they wanted better wages. They were there because they said, I'll never forget this. We were trained to do our jobs. We can't do our jobs. We don't have the staffing to do our jobs. It breaks our heart that we can't provide the quality service. Our people are suffering, patients suffering, sometimes dying. And we want help so that we can do our work. And I know that's a point you made. Am I missing something in that is the feeling of many nurses throughout this country?
Senator Sanders, you're absolutely right, that it is heartbreaking. We get, and it's not called burnout, okay? It's called moral distress. When nurses go home, and I feel especially for our young nurses who come out, and they come out with all these grandiose plans to be able to take care of their patients the best that they can, and then because of short staffing, workplace violence, just horrible working conditions, schedules that are not manageable, and they come away, especially when they have too many patients, they come away, they leave their day, they go into their parking lot crying their eyes out because they feel defeated. Okay, they feel like this is not what I signed up for. I wanted to make a difference in my patient's life, and I don't feel like I'm doing that. And just add that to the many reasons why nurses are leaving the bedside. Once again, we do not have a shortage. We are not treating our nurses right, and we need to start treating them right because they are the backbone of healthcare.
Ms. Turner, I know that the National Nurses United agrees with my position that healthcare is a human right.
Definitely.
That we need a Medicare for all single-payer system. My guess is that in your years of experience, you've encountered many patients who walked into the door who should have gotten health care months and months before. What do you think it will mean to this country when 15 million people are thrown off the health care they have because of Trump's massive cuts to Medicaid? What will that mean to health care in this country?
Senator Sanders, what that will mean, and I alluded to it in my opening statement, no preventive care, no managing their chronic diseases. And so what ends up happening is these people, how often has my story that I take from the emergency room said, patient found down, patient found collapsed in their home or whatever. Then they call 911, they bring them into the emergency room, and what do these do? Because they're in such poor shape, all body systems collapsing, they go to the ICU. Like I said, most expensive care. That's what's going to happen. They're not going to stop coming to the hospital, and furthermore, it's going to be uncompensated care.
Thank you very much.